This is Isaiah back again for an Heent, a neuro assessment. Jacob, how you doing today?
Doing good.
Alright, so Jacob's going to be my volunteer today. Jacob, is it okay if we proceed with this assessment?
Let's do it.
Alright, so first of all, tell me your name and date of birth.
Jacob Saldemar, 11/28/93.
Alright, tell me where you are.
At my house.
Tell me why you're here.
Doing another assessment video.
End of the year.
2018.
Okay, so patient is alert and oriented. I've assessed his appearance. He appears well kempt. He appears emotionally stable. His voice inflection appears calm. He seems put together. His speech isn't slurred or anything like that. No concerns there. So next we're going to assess the lymph nodes. Jacob, just let me know if you feel any pain or tenderness as I palpate.
Okay.
So we're going to start with the preauricular, and we're going to move to the posterior auricular, and down to the occipital. Next we're going to move to the superficial cervical, and then the deep cervical, and then the supraclavicular. Jacob, just pull your shoulders up and shrug, and then I'm going to move your shirt a little bit. Alright, any pain or tenderness?
No.
Okay, you can relax your arms. And then I'm going to take a look at the submental. I'm going to take a feel for it. Alright. And the submandibular. Alright, had any pain throughout that, Jacob?
Nope.
Okay, so no pain noted, no tenderness or inflammation. So next I'm going to feel your thyroid gland, okay, Jacob?
Okay.
Alright, I want you to lean your head slightly forward and to the right. And do the same to the left. Okay. So no enlargement noted. The thyroid gland feels symmetrical. Any pain, Jacob?
No pain.
Okay, no tenderness or no nodules. Alright, Jacob, I'm going to have you cover your left eye with the card I handed you. Okay, and as I point to these letters, I just want you to read them straight across. So we're going to start right here. Can you see this okay?
Yeah.
Read from left to right.
LPED, PECFD, EDFCZP, DEFPOTEC, LEFODPCT, FDFLTCEO.
Okay, so the patient scored a 2015, which is better than normal. So no issues with the left eye. Now we're going to assess the right eye. So do the same, Jacob. Just cover your right eye.
LPED, EDC, EDFCZP, FELOPZD, DEFPOTEC, LEFODFOT.
Okay, so on the left eye, Jacob scored a 20/20, which is perfectly normal. Just scored a little bit better on the left eye. Alright, Jacob, now I'm going to be testing your peripheral vision. It's called the confrontation test. So we're both going to cover opposite eyes, and I'm going to wiggle my finger in your peripheral vision. Let me know when you see it, okay?
Okay.
So first we're going to start with the right eye, your left eye, and just let me know when you see it.
Now. 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 Now.
Okay, switch eyes.
No. 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 No.
Okay. No inextinction or inattention noted. No hemiapnea noted bilaterally. Alright, Jacob, now I'm going to take a look at your eyes, okay?
Okay.
Alright, now I'm going to take a look in them. So pupils were equal round, reactive to light, symmetrical corneal light reflexes visualized. noted in the inner retina. No opacities, the lens looks clear. The optic disc is visualized as pink. The macular disc was noted, darker. Anything else, veins and arteries noted in both eyes. All right, Jacob, next I'm just gonna take a look at your ears.
Okay.
So, by visual inspection of the external canal and the ears look symmetrical in shape and size. Color looks normal for ethnicity. Are you having any pain or tenderness in your ears, Jacob? Any ringing?
Nope.
So no redness, edema, tenderness, inflammation noted. Patient denies tinnitus. All right, Jacob. Now I'm going to take a look inside your ears. Any pain?
No pain.
Okay. Take a look at the other side. Patient denies tenderness, no edema or inflammation noted, no drainage, seruma noted in both ears, no discharge or perforation noted in either ear. Alright, Jacob, next I'm going to test your hearing. So I'm going to sound this tuning fork, and then I want you to let me know if it's louder when I place it beside your ear, or when I place this on your head, okay?
Okay.
So that versus
In front of my ear.
okay, let's go to the other side. Do the same thing.
In front.
Okay, so I'm going to do the same thing. This time I'm going to put it right on top of your head.
Okay.
And then I want you to know if you hear it louder in one ear or the same in both, okay?
Okay. The same.
It's the same?
Mm-hmm.
Okay. So next I'm going to come behind you. I'm going to sneak behind you and whisper. I want you to repeat what I whisper, okay?
Okay.
And I want you to plug your right ear to start, and then we'll switch and you'll plug the left.
Okay. B2K 4J7
Okay, now switch to the other side.
704 643
Alright, Jacob, I'm gonna take a look at your mouth next. Have you ever had your tonsils removed?
Nope.
Okay, I want you to say ah, stick out your tongue. I'm gonna take a look in there. Alright, so sorry, patient's having a little bit of a cough, but other than that, mucous membranes are pink and moist. Tongue is midline, teeth are intact. No ulcers, masses, lesions, or inflammation noted. No bleeding. Jacob, are you having any pain in your mouth?
Nope.
Okay, so no tenderness. Jacob, I want you to smile for me. Show me your teeth. All right, facial symmetry is noted. All right, so Jacob, I want you to take your hands, place them like this when I tell you to, and you're gonna pat them on your knees, bring it back up, turn around, pat them on your knees. I want you to do that 3 times. And each time you do it, I want you to do it a little faster, okay?
Okay.
So go ahead when you're ready. Okay, that's enough. Alright, next I want you to take your hands like this, and one at a time, I want you to touch each finger to your thumb. And the other hand. Okay, so the patient has equal symmetrical movements bilaterally. Next, Jacob, I want you to take your finger, touch your nose, and then you're going to touch my finger, okay?
Okay.
And back. Back to your nose. Okay, now I want you to lay back. Lay down. Alright, now I want you to take your right heel and you're going to put it up at your left knee, and I want you to guide it down to your heel.
Okay.
Guide it all the way down to your shin. Okay, back up. And then do the same with the other. Okay, you can sit up. So once again, patient has equal, symmetrical, coordinated movements on either side. So next, Jacob, we're going to test your equilibrium and your balance. So I want you to stand right here. Alright, now I want you to put your feet shoulder width apart and close your eyes. Okay, now I want you to stand on one leg and do a little hop for me. Alright, and do the same on the other side. Okay, so a little swing is perfectly normal. His balance was present. Jacob, did you feel dizzy at all?
Nope.
Okay, so equilibrium was normal. Jacob, I want to assess your gait. So I'm going to have you take a walk down the hall. Alright, Jacob, I want you to walk towards the door and then walk back.
Okay.
Alright, so patient's gait was coordinated. Alright, Jacob, now I'm going to be assessing your sensory function. So I want you to let me know whether the feeling you feel is touch or sharp. So I have a tongue depressor that I've broken lengthwise, so I have a sharp side and a dull side. So close your eyes and let me know what you feel.
Sharp. Dull. 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 Sharp. Dull. Sharp. Sharp. Dull.
Okay, so next I want you to keep your eyes closed. I have a cotton ball. I'm going to touch your skin. Let me know when I touch you, okay?
Okay. Touch. Left. Left. Right. Right.
Okay, so next we're going to assess whether you can feel these vibrations. So I'm going to hit this tuning fork and I'm going to put it over your knuckle, okay?
Okay.
And I want you to let me know if you hear it or if you feel it.
Yes.
Okay, and we're going to test the other side.
Yes.
And does it feel the same on both sides?
Yep.
Okay, now we're going to do the same thing on your toe.
Yep.
Okay, another, other side.
Yep.
Okay, so Jacob, I'm going to have you close your eyes. I'm going to touch you on either your right side, your left side, or both. I want you to let me know what I do.
Left. Right. Both. Left. Both. Both. Left. Left. Right.
Okay, so patient was able to accurately describe which sides I was touching while no extinction present. Alright, Jacob, now I'm going to be assessing your deep tendon reflexes.
Okay.
So we'll start with the biceps. Okay, and we'll move on to the triceps. So just relax your arm. We'll go to the other side. Just relax. Okay. Alright, so patient's biceps and triceps, deep tendon reflexes were 2+ quality. Next we're going to move on to the brachioradialis. So I want you to just relax your forearm I'm going to hold it on top of mine. Okay, and next we're going to move to the quadricep reflexes. So I want you to relax your knee, let it hang. Hit that one a little hard. Okay, so next we're going to move on to the Achilles. So I'm going to raise your foot a little bit. You just relax it. Relax your foot. And then relax your foot over here. Okay. So next we're gonna assess for coolness. So Jacob, I'm gonna have you lie down. Okay. So basically, I'm gonna dorsiflex the patient's feet and then release. Okay, so no coolness noted. So now I'm going to be assessing for a Babinski's reflex. So we saw a little bit of flexion in the toes. With a positive Babinski's reflex, we would see the big toe kind of come in and then the rest of the toes fan out. So we didn't see this, so there was no positive Babinski's reflex noted. Alright, so now we're going to assess the 12 cranial nerves. Some of them we've covered a little bit, so I'll just make mention of them, but for those that we haven't covered yet, I'm going to go ahead and hit those. Jacob, so first I want you to close your eyes and plug one nostril. I'm going to give you something to smell. It's a very common scent. I want you to let me know what you smell. Take a whiff.
Peppermint.
Alright. And then plug the other nostril, keeping your eyes closed. And then let me know what you smell now.
Alcohol.
Okay. So the olfactory nerve is intact. I have some peppermint essential oil and some alcohol. Okay, so as for cranial nerve number 2, the optic nerve, it was assessed during the Snellen chart and during the confrontation test. Cranial nerves 3, 4, and 6 are all tested together because they have to do with eye movement, so we'll go ahead and do that now. Jacob, I want you to face me. I want you to track my finger with your eyes. Don't move in your head. Okay, and then I want you to look at the door, focus on the door behind me. I'm going to stick my finger in front of your face. Keep looking at the door. And now look at my finger. Okay, so pupils accommodate. So that tells us that all 3 of those cranial nerves are intact. Next I'm going to assess for the trigeminal and facial nerves. We'll do those together. So Jacob, I want you to let me know when I touch you, okay? I want you to close your eyes. I'm going to touch your face. And let me know when you feel me touching you. Just say now.
Now. Now. Now. Now.
Okay, and smile big for me. Alright, raise your eyebrows. You can open your eyes now. So puff out your cheeks. Okay, so the trigeminal and facial nerves are intact. Cranial nerve number 8 was assessed during the whisper test. Jacob has no problems hearing me. He hears normal conversation. He excelled in the whisper test. So those cranial nerves are intact. And so as for the vagus nerve and the glossopharyngeal nerve, those 2 were assessed, as well as the 12th cranial nerve during the throat exam with the tongue blade. And then just for the 11th spinal accessory nerve, I'm going to assess Jacob's strength. So Jacob, I want you to push up on my hands and then push down. Okay, now I'm gonna hold my hand here against your chin. I want you to look that way, push against. Okay, and then for the other side. Alright, and then shrug your shoulders for me. Okay. So his spinal accessory nerve is intact as well. Alright. So as for your neurological assessment, everything checked out, and based on my assessment and your history, I don't see very many risk factors for stroke. However, stroke is very common, and it is a leading cause of disability in America. And so risk factors include advanced age, hypertension, history of atrial fibrillation, things like that. So you may not have these risk factors, however, there are many in the community, probably many in your family who have these risk factors. So it's important to be on the lookout for these signs and symptoms, such as facial drooping on one side. So maybe when your family member or somebody in the community you see is smiling, maybe one side of their cheek doesn't go up, one side of their smile doesn't raise up as high as the other. Maybe they have trouble getting words out, they can't quite say what they'd like to say. Maybe they have numbness, or maybe express weakness on one side. So all of these could be signs of a stroke. So if you notice any of these in yourself or in anybody you notice, make sure that you encourage them to seek medical treatment immediately, as early intervention increases positive outcomes. And that concludes our video. Do you have any questions, Jacob?
No.
Okay, any concerns, just follow up with your primary care provider.
Will do.